Good afternoon. Once again, I want to thank everyone for joining me on Health and Habits. My name is Dennis Ayers, the owner of Ayers Insurance Group here in Clinton, Mississippi. Um, and today, over the weekend, I was reading an interesting article. Um, I knew this, but most people don't that go on Medicare. And people tend to shop for the lowest drug cost, the lowest premium when they are looking for um, prescription drug plans when they go on Medicare. And that can be a two-edged sword. We'll talk a little bit about that today. And you can join in on the conversation for the next 30 minutes. And we can be reached here at 1-800-492-5186. That's 1-800-492-5186. We also can be viewed on Roku TV, Facebook, and also YouTube. When you go to YouTube or Facebook, hit that subscribe or like button and make sure you share. Because what we want you to do, whenever Health and Habits is on, you can get those notifications and tune in. We're going to start a series on Medicare enrollment, the pitfalls of it, the advantages of it, because what happens is with most people are working and they have group insurance, they really don't think about what happens when they go on Medicare. But there are some pitfalls and there are some things that you want to really avoid and or look out for. But we'll start having guests on between this month and next month because open enrollment starts on October 15th to December 7th. And for those that are on Medicare, you will have a greater understanding on what it is I'm talking about because we see a lot of practices that are not only unethical, but quite frankly, illegal. And our seniors are the ones that suffer whenever those things take place. So the article went on to say lowest Medicare drug plans premiums don't always mean the lowest cost for the consumer. And that is so true because on average, the average deductible for prescription drug plans for 2022 is up to $480. And what that means in real language, when you go to the drugstore, is you are paying the first $480 for your prescription drugs before the plan even kicks in most cases. There are some of those plans out there that will work, that you don't have to meet that deductible. If you're taking one or two medications and they may be no higher than a tier 2 medication, and we'll talk about what those tiers are in a short moment. But when the lowest price may not be in your best interest. So we just want you to know that with the onset of either you retiring or you have a drug plan and you're thinking about open enrollment because you may want to change, you may want to shop around and you may want to find out which one going to work best for you. Of course, I tell anyone that you can do it by phone, you can do it online, but the most effective way is get a good quality agent. Have a face-to-face meeting with them. Do an analysis. That analysis should not cost the consumer one red dime. If that agent or that agency says there is a fee to that, abruptly quit that interview or that appointment and leave because that's not allowed under the rules of Medicare. So those are some of the things you want to look out for. But what you want to do is you have to understand, on average, there is going to be at least 23 in any given market. On average, there's at least 23 to 30 prescription drug plans out that's available to you. On average, for the Medicare Advantage plans, there are on average 30 to 45 of those in any given market. So there's a big, tall story, and if you want to compare those things, then you certainly got your hands full. That's why I say that if you sit down and talk to a broker agent, someone that covers multiple plans, then you can compare those, and they can do that for you. The only thing in most cases, what you will need is a list of your medications, and find out if your pharmacy is in network, because that's another important thing. So those are some of the things that you must do as a consumer, because you are not relieved from the responsibility of finding out this information. But what I'm telling you is you can get that information, and it's not going to cost you outside of time. It's not going to cost you anything, or it shouldn't cost you anything. So those are some of the things that we will talk about. In most cases, like I say, on standalone prescription drug plans, the average deductible is going to be somewhere right around $480. And you can buy these plans for as cheap as $15-16 in some markets. But on average they're anywhere from $17 to about $20, $25 to $30. But you can get those. You can also get a prescription drug plan if you have an Advantage plan. And the average deductible on an Advantage plan is an all-in-one is going to be somewhere right around $400. These are what they call the all-in-one plans, and generally those are the ones you see advertised on TV concerning the additional benefits and whatnot. Those may or may not be a good fit for you. Once again, you want to sit down with a licensed agent, preferably in person, and discuss what your needs are, what your concerns are, and what you want your health care to look like on Medicare. Because there are some advantages to those Advantages plans, but also there are some disadvantages to those plans. Here in our state, we know that if you want to keep original Medicare, all you need is a prescription drug plan. But there's so much financial exposure with original Medicare that it's not very wise. I certainly don't recommend it, but people do it because of the cost of original Medicare, the co-pays and deductibles. Those things don't stop. So what most people do, if they want original Medicare, then what they'll do is they'll get what they call a supplement or a Medigap policy. And those things are going to cost a little bit more than what the Advantage plans will cost, and then you still have to get your prescription drug plan. So there's a lot of information that we're going to share with you over the next 4 to 6 weeks prior to October 1st, because what's going to happen on October 1st, you're going to be bombarded with a bunch of mailers, a bunch of phone calls, and it's going to be wild. And those things you look out for that are not legal, and those are people that are approaching you in common areas such as a grocery store, such as the doctor's office, asking you, are you on Medicare? Could they talk to you about certain plans? If you do not initiate that conversation, then that conversation is illegal. And what I would do is I would encourage you to follow up with that with either the state commissioner's office or call Social Security or Medicare and report that, because we have to patrol ourselves. There are enough quality agents that's in this business that don't do that, to where when those that do, because what happens when you run across those individuals, chances are they're going to sell you something that you can't need, that doesn't do you any good. They're going to sell you something that they can make money on, for one, but for two, that may not be in your best interest. So, I'm an insurance agent, and yeah, we should report those bad actors. So give us a call at 601-492-5186. That's 800-492-5186. If I said 601, it's an error. It's 800-492-5186. And if you need to reach out to me, you can reach out to me at Ayers Insurance Group. Go to my website at DennisAyers.org. You can go in there and we can set up some time. You can set some time and send a request to have a meeting, either at your home or at my office. What we'll be talking about is get those needs analysis done. We're also going to be doing some Medicare educationals to educate the community on what Medicare is about, what's involved in it. We will not talk Plan Pacific, but what we will do is just kind of share with you the same pitfalls that I'm talking to you about. We'll go more in depth in person, because you need a trusted advisor when it comes to dealing with Medicare. We're going to take a short break here in about 30 seconds, but what we want to do is we want to make sure that you understand all of what's going on. You can also reach me at my company phone number at area code 601-209-9853. That is 601-209-9853. But you can also reach us here at Roku TV when we get back from the break at 800-492-5186. We'll be right back.
Socrates Garrett ENT.com is a diversified firm specializing in recycled aggregates and crushed concrete. Socrates Garrett ENT.com's recycled materials provide the construction industry with significant economic and environmental benefits by recycling clean concrete rubble into M.DOT grade rock materials. Recycled aggregates and crushed concrete can be applied to driveways, road construction, bank protection, parking lots, general bulk fills, and more. For more information, please call 601-896-0084 or visit us online at SocratesGarrettENT.com.
The Mississippi Link is an African-American female-owned newspaper with a trusted voice that is highly respected throughout the city, state, and nation. Our motto, keepers of the knowledge for people who speak the truth, since 1993. Link significantly influences the thoughts, attitudes, and buying decisions of its readers. Call us at 601-368-8481 for your advertising needs. If you would like to receive a newspaper in the mail each week, our annual subscription is only $52 per year. That is only $1 per week for you to stay informed regarding many stories that you can only get in the Mississippi Link. Sign up today at themississippilink.com and click on Home Delivery.
Okay, we're back. And once again, my name is Dennis Ayers, and this is Health and Habits. The show that talks about health care, non-political, We just want to just make sure that you get the best quality of life in your health care. So we were talking about when you go on Medicare, that your decisions are a lot different, and they are not like your group coverage that you have at work or you've had at work for the last 20, 25, 30 years. But you are now in your health care now is covered 80%. If you have Medicare Parts A and B, that's going to be covered 80% through Medicare, and 20% will be your responsibility. Now, as of 2006, you are required to have what they call credible drug coverage. And if you do not enroll in a drug plan when you first get onto Medicare, you have 7 months, actually. You have the first 3 months, you have the month of, and 3 months after. But if you miss that deadline, you will start to incur a penalty. At 1% for every month, you do not have what they call credible coverage. Now, there are some exceptions, and one is you have an employer drug plan, either a union plan in retirement, or you may have Medicare and you're still working and you still have your group plan at your job. So, and that would exempt you from that. The other exemption is if you qualify for what they call extra help or Medicaid, then you don't have to worry about that penalty. So what we want to do is we want to just kind of, the first part of our show, we went over the pitfalls of getting into a drug plan, just picking up any drug plan. That may not be in your best interest. It's always in your best interest to talk to somebody about the drug plans, talk to them about the types of medication you're on, because when it comes to prescription drug plans, it's not a one-size-fits-all. What may work for your neighbor may not necessarily work for you. That's why it's so important that you talk to someone who is qualified and licensed to be able to go over with you exactly what plan may be out there that may be a good fit. Once again, most people are ill-informed when they do this. They tend to look at TV. They will call that 800 number. And I'm here to tell you, you kind of get what you get when you call that 800 number, because that may be someone not in the state that may sell you something, and they simply don't know what we call the lay of the land. They don't know. They can look on the computer screen and look at provider networks. They can look at zip codes. But we who live here, we know that you can go 2 blocks over and be in a different zip code when you may have a doctor right across the street that will work just as well for you. So those are some of the things that you should really take a look at. We are down to our last 10, 12 minutes, so give us a call here at 800-492-5186. That's 1-800-492-5186. And there are so many plans out there that you really should talk to a licensed agent. If you are not sure how it works, if you want to consult with a reputable company, give us a call at Ayers Insurance Group. And this is at no cost to you whatsoever. We will do a consult. We will do a needs analysis to find out what is the best plan for you. And if you have someone else who you want to enroll with, that's fine with us. But at least let's put you in the right direction. Let's put you on equal footing to where you understand what's going to work best for you. So you can reach me at my company phone number is 601-209-9853. You can shoot me a text and I will respond. Or you can go to my website at DennisAyers.org and punch in a request, and I will respond to it. It'll send me an email, and I'll respond to it. And what we will do is we will set up some time to go over that information. There's a couple other things that you may not understand. Once you go from your group to the to Medicare, it's very, very important to find out what types of medications you're on. If you're on name brand, if you're on generic, there is a thing called the coverage gap, or what is commonly known as the donut hole. And for those who have been in that donut hole, who are in that donut hole, you know exactly what I mean. Because what happens is the cost of your medication now goes up. So that's another reason why you want to make sure that you talk to someone who can help you through this, who can walk you through it, who can give you some quality advice without the pressure of feeling you have to buy something from them. So, because there's a lot of people that's gotten caught like that. And we just simply don't need to play that game. So give us a call at 800-492-5186. You can always, if you missed this message today, you can always go to Roku TV, WeBelieveDigital.com, YouTube, and also Facebook. We Believe Digital Facebook page. And when you do, please hit that subscribe button. That way you'll get those notifications every time Health and Habits come up. Also, share and like. And that way we can get the information out, because what's going to happen is here in the next 2 months, we're going to be talking more about the open enrollment period, or AEP. And that's when you can switch those plans if you are having issues with the one you currently have. And that will be an opportunity for you to look at all the plans out there in your service area, compare them, and then by December 7th, you can change in between October 15th and December 7th. You can change as many times as you need to change. It's just a free-for-all. But at 11:59, December 7th, when that 12 o'clock hand strikes, you're tied into that thing for a following year, to the following year. Now, there is a thing called OEP, and that's for another conversation. So, there's a couple of ways that you can get back to something else, but we'll have to talk about that. That'll be for something different. There are quite a bit for veterans, and hopefully we will have someone on the show that will represent veterans, because a lot of those benefits, VA benefits, are changing. And there are a lot of plans outside the VA that will allow you to continue to use the VA, but also allow you to use outside doctors. And generally, those are for our vets. And thank you for your service. Those are for our veterans that do not have TRICARE for life, but still have access to the VA. We are in a rural state. And, a lot of our veterans are traveling 60, 65, 70 miles to come see a provider. Well, once they get to the VA, they know they're going to be sitting there. No one just walks in and goes to the doctor and leaves. But generally, they're sitting there for 2, 3, sometimes 4 hours, and then have to drive home. So we're gonna talk about all those. We're gonna have a representative. we're going to work real hard on getting our veteran service officer here for Hinds, Madison, and or Rankins counties, the counties that are surrounding the studio, but they can provide the same information. So that's what we want to do, and we certainly want you to call in because we certainly want to hear from you because things are changing, and they will explain that very well. Write down our number. And keep us in mind for the future. We're here every Tuesdays and Thursdays from 3 to 3:30. And that number is 800-492-5186. That's 1-800-492-5186. So, the next couple of months are going to be very, 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 very intensified. And loaded with a bunch of information. So I would strongly advise anyone who's listening to get a pen and pencil and write down this information, because we're gonna fill the airways with a bunch of information. Because what we do know is that there are people that are selling these plans that, quite frankly, should not be, because they're doing it in not a so compliant way. Once again, if someone approach you in a grocery store, or they approach you in an area and it's unsolicited, it's illegal. If anyone knocks on your door unsolicited and talk to you about, we have a plan for you, or you didn't sign anything, or you didn't call one of those 800 numbers and they say they did, they say you did, even if you did, then at any point you can cancel or you can stop that interview and seek out someone local, seek out someone reputable, and someone that will give you straight answers. At Ayers Insurance Group, we can do a needs analysis. We can check the drug plans. We are a brokerage. We can check to see what's out there for you, what'll fit best for you. And you can reach us at DennisAyers.org. Go on and you can type in a request. That contact information will come directly to me via email. Also, you can call me on my company cell phone at 601-209-9853. We want to get some things right. God has been good to me and my household, and we are by no means chasing dollars. But what we want to do is to make sure that our seniors in our community get the information that they need to make a quality decision about health care. I'll tell anyone, you do not have to purchase from me, but if you're in front of me, I'm going to be honest with you, I'm going to be straight with you, and we're going to give you the information that you need for you to make that decision. Okay, our time is about up, but we wanted to let you know that we're going to start this for the next 4 to 6 weeks, and we're going to be talking about the Medicare. We're going to be getting those experts in to share with you. Certainly people that know way more than I do, and we're going to give them that platform to do just that. But once again, you can view us on WeBelieveDigital.com. You can see us on Roku TV, Facebook, We Believe Facebook, and also you can see us on YouTube. Remember to hit those like buttons and the subscribe button, and also share. And we will make sure that we get information out. We want to be a quality provider of information for you. I'm Dennis Ayers with Ayers Insurance Group, located in Clinton, Mississippi. You can reach us at DennisAyers.org, or you can reach us at the company phone number at 601-209-9853. And once again, I want to thank you and God bless. If you want to change those outcomes, then get to do healthier habits. Thank you.